now, pediatricians across the country are sounding the alarm about the mental health of our children. That is our cover story tonight. September is National Suicide Prevention Awareness Month, and the American Academy of Pediatrics is reporting an increased prevalence of depression and suicide in pediatrics in conjunction with limited resources in the community. Emergency departments across the country, they're seeing an uptick in young people experiencing mental health crises. But they aren't always the best fit for treating pediatric patients' mental and behavioral health concerns. Atlanta News First anchor Savannah Louie explains the efforts in Metro Atlanta to better serve our children.
We have to make the entire community aware that children are struggling and that we can wrap supports around them.
Allison Ashe speaking up for children trying to find a voice, providing aid for families of kids struggling with mental and behavioral health at Wellroot Family Services. Programming includes suicide prevention, parent teaching and coaching, and foster care support.
If you do a family systems approach and everyone is in therapy together, you really decrease shame and blame.
Ashe reports an increase in requests for service over the past 3 to 5 years. Many referrals coming from Atlanta area emergency departments.
If a child goes into the ER and they are in kind of an initial stage of crisis but don't need residential care, they can come to us, refer them to us, and we can serve the whole family.
The American Academy of Pediatrics acknowledges emergency departments vary in capability to care for pediatric patients with mental and behavioral health conditions, particularly minorities, youth with disabilities, immigrants and non-English speaking, LGBTQ+, low income, and those in the juvenile justice system.
It's normally not the emotion that we struggle with, but it's the judgment of the emotion that makes it so painful for us.
Jody Baumstein, clinical therapist at Children's Healthcare of Atlanta, says mitigating mental health challenges begins at birth.
We're going to talk to babies and, oh, you're crying, you look sad. I'm smiling, I'm happy to see you. And we're starting to name that to really build that foundation.
Understanding how and why we feel our emotions is essential to fighting a mental health epidemic any child could be susceptible to.
All right, now I do want to go over some of those signs because it's pretty important here. We're talking about maybe a shift in mood or behavior, becoming withdrawn from your hobbies or your friends, changes in eating habits, or being on edge and also being tearful as well.
Yeah, something parents certainly need to look out for. And Savannah, there is actually a disparity among children experiencing some extreme mental health crises, isn't there?
Yeah, Tracy, so this is pretty worrying here. Black children are 2 times more likely to commit suicide than their white counterparts. And Native American children, they report the highest rates of suicide. Wellroot Family Services says that families in rural areas might also struggle to find mental health resources for those children.
Yeah, we certainly have to take care of our kids. Savannah, thank you.
Yeah.
Well, if you or someone you love is struggling, know that you're never alone. Georgia offers a free 24/7 call center for access to services. Or just text 988 to contact the Suicide and Crisis Lifeline.